On today's episode of Unfolding Journeys, we have Dr. Olivier Carpentieri with us. Dr. Olivier is an osteopath based at Yutopia Clinic in Dubai. With over 17 years of experience and 30,000 patients treated, he has developed a unique therapeutic approach called the Neurolink Process, which focuses on regulating the nervous system. Join us as we explore his innovative methods and visions for making this process accessible to everyone. Welcome to Unfolding Journeys, Dr. Olivier.
Hi,
Great
Sharon.
to have you.
Thank you.
We have loads of questions for you. We want to understand the Neurolink process, so I'm going to get started. When did you first become interested in osteopathy, and what inspired you to pursue this?
So it started after an injury. I was in sports university and I had an injury at rugby, and my father-in-law was a Chinese doctor, and he fixed me like just by not acupuncture but digipuncture, and I discovered that you can fix the problem without touching the area in problem. So I was very interested by this kind of treatment, and introduced me to osteopathy because it was recognized at the moment in France, and I checked what was, and I have been very interested by it, and so I started the studies.
That's amazing.
Yeah.
And how long have you been practicing? Around 17 years, right?
Yeah. In 2009, I started at the office.
Okay.
Yeah.
Incredible. How long have you been in Dubai now, practicing at Yutopia?
Close to 1 year now. I've been here for 1 year, and yeah, I love the Yutopia Clinic because we work all together with the other practitioners, more focused on the functional medicine, not the allopathic medicine. So we try to fix the roots of the problems and not just the symptoms.
And do you see a massive difference in the way it's treated in France and here?
Yeah, definitely. Because we are all expats mainly here, we come alone, we don't know a lot of person, and there is big communities, even in practitioners. Usually in France, I used to work alone. Even if I know some pediatricians, doctors, and psychiatrists, we don't work really together. Here, it's completely different. We exchange about the patients, we exchange the patients also, we refer a lot, and I really appreciate this here.
Do you feel it has a more community feel to it?
Yeah, definitely.
Okay,
definitely.
that's amazing. At what point in your career did you start incorporating the Neurolink process into your practice, and what motivated that decision?
Okay, so I wasn't an osteopath yet when I discovered this treatment.
Okay.
I was at school, and there is students who helped the professors during the last year of studying, and I just asked to look at my back because I had back pain between the shoulder blades at one practitioner, one student, and I lay down on the bed. She did the assessment and she started to treat me, and I felt something I never felt before, and it was completely different as everything else. She knew how I work, where are my tension, emotions, and when I sit up and stand up after, I was like straight, upright. I was able to breathe deeply, quiet in the mind, more focused. I was very, very good, like never before. And I understood that she touched the good things. And this person was the daughter of my professor, and so I immediately asked him to do the trainings, but I wait the end of the studies to start to learn this.
And how long did it take you to learn the Neurolink process itself?
So it took around 1 year to have the basis. But it took more for being more accurate, more efficient into the tissue to understand more properly how this process works into the body.
And you're training
now,
other people now, aren't you?
Yes. So sadly, my professor passed away last year, and I'm the trainer now. And Yeah, I train osteopath mainly, but I can train also other people who could be interested and with the capacity of treating.
You're the only one who's able to train other people, is that right?
Actually, I think I'm the only one.
Okay.
Yeah.
That's incredible. That's pretty incredible. For those who are unfamiliar with Neurolink process, could you describe what it involves?
Okay, so mainly the brain manages 100% of the information into the body. So I use this fundamental physiology to treat the body, the brain, the emotion, the function. We can act on all of this just by passing by the brain. So it's neuroscience that involves the same process your brain use to manage information, or mine, for example. It's a fundamental blocks of the program. And yours, even if your program is different as mine, because your emotions are different, the way the brain manages information is the same for you and me. So I use this to change the response into the body.
Is it sort of like hypnosis and moving energy out of the body? I'm just trying to understand it better.
So let's put the energy away just for a bit. The brain registers the information while you are sleeping. So that's why we have these different states of sleep. And we need to put the brain quite in the same state to remove the information it blocked. So for example, when you reach a high stress, physical, emotional, toxic, infection, you can keep inside this emotion, this stress, and it's a new information turning in loop into the brain. So that's why, for example, that disturbs the sleep after. So by putting the brain in the same state, quite like, we allow it to work on this information and to remove it. So we can remove also the symptoms linked with it. So yeah, it's an hypnotic state, but deeper than hypnosis. I did some EEGs on a few patients, and we see unique patterns on the brain during the session. We have all the different waves of the sleep, but we can see them in only 30 seconds. And it's impossible in the normal state. And also we have an asymmetry into the brain activity. So one hemisphere is sleeping, and at the same time the other one is in normal activity.
Okay.
So it's completely unique.
So when a patient comes in, like when I come in to you, do you do it in three, like do you have a process, step 1, step 2, step 3? Or how does it work?
So like all the practitioners, we ask questions, you come with complaints. I just discuss with you about your history, so I can have a full frame of your life and traumas. And after that, I do assessment by the tissues. I enter into the fascias, and this assessment is very quick, and I see where are your tension, because you are managing all your emotion and all your body balance by these tensions.
Okay.
And after, I stimulate the brain and the body, and I put the brain into this state. I let the patient around 10 to 15 minutes. It's the time necessary to rewire the information. And after that, I put back the brain to normal state, and I...
without anything, without surgery, nothing?
No, nothing, just by the fingers, no tools, no machines.
It's magic.
Look, when you use a remote for your TV, you cannot use the garage door remote for switching on the TV. It's not the same frequency, it's not done for that. It's not for that. So I just balance myself to be into your tissues, so that avoid the filter and the mirror effect. So when I enter into your tissue, I'm at your level, not mine. So this is the tricky things of this process. I cannot be like you are on a daily basis.
How does the Neurolink process interact with the nervous system, and what benefits does it provide?
Okay, so I mentioned that the brain manages all the information, specifically, it's the limbic system. The limbic system is the emotional part of the brain, but it manages all the information from the inside the body and from outside. So this limbic system gives an answer, a response into the body by the autonomic system and by the cerebellum in the back. Mm-hmm. So that acts on the muscle tones and also on the visceral, vascular, and hormonal system. So by targeting this limbic system, we can change the answer into the body. So in this way, we can act on many symptoms, not by acting on the symptoms, but by acting on the core of the problem.
Can you share some success stories or examples of patients who have benefited from this process?
Yes, so many. I can talk about 25 years old headaches, for example. Mainly it was because of trauma for this woman, and she tried many things in her life, even osteopathy, and just by removing the memory of this trauma, we fixed the headaches after 25 years old.
And do you work on different conditions? Can you work on different types of conditions and all ages?
Yes, we can act on newborn, on athletes, elderlies, everybody, on sedentary people, on sick people, whatever. We can work on everyone.
Was it recently that you cured a guy with one eyesight?
Yes.
How did that work, or how did that happen?
So this guy lost the vision on one eye after the COVID. So because the stress of the COVID is too high into the body and the brain, so he fixed this, but that attacks the brain. And he did all the tests about the eye, about the brain, all was clear. And I saw this guy 1 year after. So during 1 year, he wasn't able to see on one side. And I removed the first trauma, but it wasn't related with this. So he came back 1 month after for the follow-up, and we found another trauma, not related also with the COVID. So I pleased him to come back, to trust me, and because once we remove the trauma, after we can see the benefits. I removed at the third session the trauma of the COVID, and at the end of the session, he sit up and say, "Oh, but I see you." Yeah. And at the beginning of the session, we are more distant, and I ask him to mask the good eye and to tell me if he see my hand, if he see my hand, and several parts. And he wasn't able to see my hand. At the end of the session, it was just a small area where he wasn't able to see my hand. All around, he was able to see it. And so he did the test after with the ophthalmologist, and he recovered 95% of his sight.
That's brilliant.
Yes. So.
And is he living happily now with his vision back?
Yes. It looks like a miracle, yeah. But it's just neuroscience.
And how many sessions did it take?
For him?
Yeah.
To reach the trauma of the COVID, just 3 sessions. But if you come and we can fix it at the first session, in 1 session it's done.
It's pretty amazing.
Yes.
Are there any misconceptions about osteopathy and Neurolink that you often encounter?
Yes. People know osteopathy as a manual practice with cracking, soft adjustment, craniosacral, and mainly working on the mechanic. So for back pain, joint pain, neck pain, well, mainly is this. But the goal of osteopathy is to give back the mobility into the tissue. So in this way, we can act on many things. But there is a limit of this process because of the nervous system, where we mentioned this before. So I act on the core of the problem into the brain without manipulation, without soft adjustment. It's very slight stimulation into the fascia. So that looks weird when you see me working. And some people say it does nothing, but I'm targeting directly the brain, and as a patient, you experience it. The feeling is completely different as everything else.
You do. I'm proof. After going to you, I felt different, so it definitely works. What keeps you motivated and passionate about your work?
Seeing patients happy, going back in their life, fixing their problem. When you have a problem for years and you try to fix this, the journey could be very complicated, trying to find a solution with different therapists, and just sometimes in one session you fix it. I'm happy for them, for being able to help them, because people help me also. And when you move on of your problem, you can enjoy your life. So yeah, it's this. Mainly is feeling people happy in their life. And I don't push the treatment. So one day they are fixed, it's done. I let them doing their life. They come back when they need, but sometimes it's years after.
How do patients find you? Because there is nothing out there about Neurolink. So is it mainly word of mouth?
Yes, definitely word of mouth. So in France, in my office, I was working there for 15 years. So people knew me for a long time. They talk about me. So they refer me patient. Here in Dubai, I'm new. So it's basically word of mouth and Instagram to showing to what I do. But yeah, definitely word of mouth. Because when you live it, you can talk about it. Experience it, sorry.
Last question. What are your long-term goals for Neurolink Process and your practice?
So I want to show to the world this technique, to spread it into the world, mainly in the osteopathy world. Not because it's my stuff, because that can fix and help many, many, many other people. So my long-term view is training a lot of therapists and also opening clinic in the world. But not only with my technique, with other functional doctor and people we can work all together like we do in Yutopia. So I want to extend this in other places. And also I want to involve all of these clinics and the therapists to treat people who need. Because not all the people can have an access to this therapy, and we can fix trauma, big trauma. So for raped women, abused kids, and post-traumatic stress disorder from wars, for example, we can fix this trauma for free. I want to provide this as a more humanitarian way.
That's incredible. Thank you so much for sharing all of that with us today.
Thank you for having me.
I'm sure you'll be booked and busy.
Yeah, I hope.
What you're doing is absolutely amazing. Thank you.
Thank you so much.